Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne, answering the question of the week. And Dr. Payne, the question here is, can a doctor who specializes in another field other than plastic surgery be allowed to perform surgery? Dr. Payne, why don't you follow up with that?
Sure, that's a great question. It's a very important concept to understand. And I don't want to get too into the political and policy backgrounds, but the reality is a medical license lets a doctor do basically anything they want in the state that they're licensed in. And what keeps that in check a lot of times is the hospital, places that you're going to perform procedures. A hospital, an ambulatory surgery center, something like that. Where it gets a little stickier is in the office setting when things are done, say, under local anesthesia or in an outpatient setting. Then you can get a little outside your field and you're not really breaking any state laws. That's okay. We should keep in mind that all surgical fields were developed by people kind of getting a little bit outside what they may have initially been trained for. But I think there's a difference between what happened in the history where you were developing fields and today where people may look at something and say, well, I'm not doing real well in whatever field I'm in, and I'm going to try to do this because, it seems easy or people seem to want it. That is where it gets a little more dangerous. And when you're having a surgical procedure done, you want to make sure that the person knows what they're doing. They're trained for it. They've got the proper background. If they don't have the proper background, you have to look at it carefully and see whether it makes sense for the person to be doing that. What we do is we don't hide behind any fringe credentials or anything unusual. All the things we do, we've got hospital privileges to do these things. I can go to a hospital and do all the surgeries I do right there because the hospital's looked at my qualifications and they're happy with it and certified and so forth. That's the same for many surgeons that are in either plastic surgery or, say, general surgery, orthopedics, whatever it is. Right up there, I've got my certification in plastic surgery. This is actually a college degree. My plastic surgery certification's in the other room, but it's the same thing. You can look me up online. No problem there. So I would say, yes, a doctor can do a lot of things that you might not think they would be doing based on their background. It's legal. It can be safe, depending on their personal experience, but you have to be a little careful. And a lot of surgeons, myself included, we don't try to hide behind, fringe certifications or anything like that. We have the real credentials, and that's it. We just do the best work we can for you.
Well, thank you, Dr. Payne, clearing up the matter on being certified and getting plastic board certification. So if you have a question for Dr. Payne, please visit our Facebook page or website. And Dr. Payne, we appreciate your time and we'll see you next time.
Great.